Hi folks, Matt and Ashley here again as a follow-up to our concussion series, and talking about how athletic therapists can fit in identifying concussions and managing them both on a field setting and in a clinical setting. So first, one of the things that we do a lot of is field work, so going out to basketball events and volleyball and working in professional sports and with Olympic athletes. And so we are often kind of on the front lines there of when somebody has a mechanism and might start exhibiting some symptoms. So oftentimes it's left up to a coach or the ref or an official or mom in the stands or something like that to try to help manage these things. So it's great to have an athletic therapist there who can really go through either a sideline scat form, the head check health program, or a combination of the two to try to figure out, is this something that this athlete should be going to the hospital for to get checked out for, something more serious, or steps to manage them kind of in the immediate future.
And so then the other side of that is that occasionally we have people come into the clinic who may have hurt their neck, or they may know that they sustained a concussion and they're coming to us to figure out how they get back into their sport. So some people don't know they sustained a concussion, so usually during their assessment we'll also break out that sport concussion assessment tool or head check health and go through their symptoms, go through their cognitive assessment, go through their balance, just see kind of where they're starting out. If we think they may have sustained a concussion, we just let them know. And we still treat it like any other injury. So usually these people have some sort of associated neck issue, whether they've strained a muscle in their neck or they've sprained some of the ligaments in their neck. And we treat them hands-on and with exercise like we would with anybody else, but we do have to be mindful of the concussion when we're doing exercise. So that sport concussion assessment tool leads us through a return to play protocol. So unfortunately, that return to play protocol sometimes has its limitations because it's been created for contact sports, and that's not always what we're seeing. So a lot of the times we have artistic athletes who, maybe they're gymnasts or cheerleaders or figure skaters that don't have contact built into their sports. Same with a lot of other court sports, they're not contact. So we do have to modify those, and we've got lots of experience with those sports that we feel comfortable giving you a return to play that's right for you and appropriate for your sport and hopefully get you back as soon as you can.